Hi everyone, welcome to the video of congenital talus equinovarus or also known as clubfoot. Today we are going to talk about clubfoot or CTEV or congenital talus equinovarus. So the topics will be first of all its introduction. So in introduction we will say about what is CTEV and the sign and symptoms of it, functional losses and the orthotic management. By the name of CTEV, you can identify that it is called congenital. So congenital means it is arise by birth. So congenital talus equinovarus is a congenital deformity of the foot, where the foot is in twisted inward and downward. It is one of the most common foot deformities which affects around 1 in 1000 live births globally. Now let's talk about sign and symptoms. So the primary deformities of the clubfoot is cavus, that is the increase of medial arch, adduction of the forefoot and varus at the hind foot, and equinus of the ankle joint. So in clinical appearance, medial plantar view, equinus at the ankle, posterior crease at the ankle, deep crease on the mid of the foot, concave medial border, and adducted and inversion of forefoot. From the lateral view you can see the adduction and inversion of forefoot, apparent shortening of the hallux, convex to the lateral border, and prominent of body of the talus from the dorsal area. Now the posterior view you can see that the equinovarus at the heel is small tucked up at the hip, the Achilles tendon tightness and the posterior crease of the ankle joint and the atrophic cup muscle. Functional losses of CTEV. So untreated or poorly managed CTEV can lead to functional losses like mobility, daily activities or overall quality of life. So first of all, if you say that mobility changes will come as abnormal gait. So the inward twisting of the foot makes it difficult to walk normally. Also the decreased range of motion can happen. The rigidity of the foot or muscles or joints can limit the movement like dorsiflexion, plantar flexion, inversion or eversion movement. Now the second point is pain or discomfort. So the abnormal position of the foot causes the uneven weight distribution and can lead to chronic pain of the foot, ankle or lower limb. Also it can increase the pressure sore or callus of the weight bearing areas. Now the other point is weakness in muscles. Underdeveloped calf muscles may reduce the muscle strength, making standing or walking more challenging. Now let's talk about the orthotic management of CTEV, Ponseti method or foot abduction brace. So the purpose of it to maintain the corrected foot position after casting. This Ponseti method is shown to be more effective than other treatment version. So here the serial casting is done to correct the position, and this treatment is started as soon as possible after birth and it starts with serial casting. So this casting is hold the foot position is in neutral position, and by progression of time it correct the deformity. And also it has a great success rate of over 95% if the process is following correctly, and it reduce the need of extensive surgeries. If the equinovarus condition did not correct it just after beginning after the birth, the equinovarus position of a child can be placed. To correct the deformity, an orthotist gave the prescription of AFO. So AFO, also called the ankle foot orthosis, it helps to correct the position of the foot. It's a custom-made device that support and stabilize and correct the deformities of the lower limb. So it provides stable base of weight bearing to correct abnormal weight distribution and helps to improve the gait and align the foot properly. Now let's talk about conclusion. Clubfoot or CTEV is completely treatable with the right care at the right time. Treatments like the Ponseti method and supportive devices like ankle foot orthosis, this helps to correct and maintain the foot position. Thank you for watching. If you found this helpful, please like, share and subscribe.